And as we just said, the first HMPV case has been detected in Bengaluru. Karnataka Health Minister has called for an emergency meeting with the Health Ministry. This meeting is going to be taking place at 12:30. So that's the first case in an 8-month-old child in Bengaluru that has detected the HMPV, which is definitely raising concerns amid reports of the HMPV outbreak in China. So the first case has been detected in a young child, surprisingly in an 8-month-old child. And as I just mentioned before, young children, small babies are most vulnerable to this particular virus. So that's the latest coming in about the India HMP first case that has been detected in an 8-month-old child. Harish joins us now for the latest on this. Harish, is there a cause for concern? It's so shocking that this baby hasn't even traveled and has contracted the virus. What are you hearing from the State Health Ministry and from the hospital?
Well, right now, the State Health Ministry trying to see if she had come in contact with anybody who had traveled to China. They're also going through the travel records of family members as well to ascertain where this started, from where she got infected from. That's something that is worrying. At the same time, they've reached out to the union government asking for further guidelines. Remember, the state labs, including, in fact, NIV Pune, doesn't have the exact strain that is causing the spike in number of cases in China. That is something that makes it a little more complicated because for whether the health agencies or state governments to decide on how to go ahead with this, they need to understand if it's the same strain or a different strain. And that is something that they're waiting for from the ICMR and the Union Health Ministry, more details on that. At the same time, this has been conveyed to the union government, asking if there is a need for genome sequencing of this sample. That is something that will be discussed in this emergency meeting called in by the health minister as well at 12:30 to decide what steps need to be taken, because there was an advisory given on the 4th of this month, but that was more general in nature. But now that there is a case that's been confirmed from a private hospital in Bengaluru, what more needs to be done? And if a girl with no travel history has managed to get this, would they want to do random surveillance sampling?
Just very quickly, Harish, has the baby been isolated, and in particular her parents, and also is the state government in touch with the Union Health Ministry? Is the state government, are they equipped to manage respiratory illnesses? I know there is no surge in cases yet, but how are they preparing themselves?
Well, right now, all of the SOP that's in place after COVID to deal with influenza-like cases, that has been put in place right now. They're also trying to see if anybody else in the family has similar symptoms. That is also being done. All this has been conveyed to the Union Health Ministry, seeking further direction on how to go about this. And they would need expertise of the ICMR as well. So that has also been sought in case the union government decides to go ahead and go in for a genome sequencing of this sample, and or if they believe that this needs to be retested at any of the ICMR accredited labs, because remember, this has been tested at a private hospital lab in Bengaluru. That too is something that they are waiting for information from the Union Health Ministry. In the meanwhile, this meeting at 12:30 today will decide whether the state government wants to have additional measures in place, or do they want to go in for random sampling in crowded areas to ascertain what is the kind of spread of this disease.
Right, Harish, thanks so much. So HMPV is here now with India detecting its first case in Bengaluru. An 8-month-old baby has been detected with HMPV virus, and her sample, in fact, has turned out to be positive. But all measures are being taken to contain it, and the child has been isolated as well. In fact, preparatory measures have also been put in place, and the Health Ministry in Karnataka will be holding an important meeting at 12:30.